Hello, welcome to my presentation. This presentation is going to be about HIV prevention programs. I was gladly partnered for this class with Project STAR, a HIV awareness program. Hi, I am Bryana. I'm your speaker for this presentation, and it is such a pleasure to speak about my experiences with you all. I am passionate about serving my community. This class has pushed me to become more equipped with the knowledge to further the education and advocacy in my community. Today, we will be speaking about HIV prevention programs that serve the youth population. What is HIV? Basic education. Human immunodeficiency virus, HIV, a virus that attacks the body's immune system. Without the proper treatment, this virus that wears down the immune system can lead to AIDS, acquired immunodeficiency syndrome, which further weakens the immune system. Transmission. How is HIV transmitted? HIV is transmitted through semen, vaginal fluids, rectal fluids, and also from mother to child through breast milk or childbirth. Who are at risk of transmitting HIV? People who are at high risk of transmitting HIV are people who share needles, intravenous drug users, have unprotected sex, vaginal, oral, and anal, are expectant mothers with HIV, childbirth, or are new mothers with HIV through breastfeeding. Some of the treatment options that they have are antiretroviral therapy, also known as ART. Is a combination of medications that helps individuals who live with HIV to have long and healthy lives. In the long run, with this proper care regimen, an individual can become HIV undetectable, which severely reduces and eliminates the transmission risk of HIV. ART medications can be provided through pills or a long acting injection, also known as LAI, that are administered every 2 months. HIV Prevention Program, Youth and Adolescents. Project STAR, Seriously Talking About Health Risk, is a youth organization that is located in the Bronx, New York, and is in partnership with Bronx Care Health System. In great partnership with the Pediatrics Department, Project STAR has the capability to promote health screenings through community outreach. The mission of this outreach is to care for adolescents and young adults through a mobile unit that goes to underserved communities within the South and Central Bronx to provide various health screenings to the community with the promotion of HIV prevention. There is a specific goal for Project STAR on supporting youth for the ages of 13 to 25 years of age. HIV prevention programs are important because breaking stigma, normalizing conversations about HIV to reduce fear and discrimination, promoting treatment, helping people start treatment early and learn about access to PrEP and PEP, building community partnerships, partnering with schools and clinics to expand outreach, safe sex education, providing accurate information through counseling and literature to encourage safe sex choices, providing free confidential HIV testing, ensuring the privacy of patients to remove the barriers to testing for early detection. Advocate for health equity, tackling the root causes and lack of access to health care. HIV prevention programs, community organizing strategies. Some of the things that Project STAR has done when it comes to community organizing strategies is correlation building, culturally relevant practice, and starting where the people are. To give a rundown, I'm going to go through each one. Correlation building. Project STAR has the capability of providing services to the community that are greatly impacted by the risk and consequences of HIV. According to Minkler in Chapter 17, it speaks about bringing together diverse stakeholders to work together for a common goal, Project STAR works closely with Bronx Care Health System Pediatrics Department to serve youth between the ages of 13 to 25. This greatly impacts the work that is being done in this HIV prevention program because it helps to coordinate services such as providing testing, education, and counseling for patients. Project STAR ensures that they represent communities at high risk, which are not just youth in the South and Central Bronx, but communities such as the LGBTQ community, people who use substances, injecting drugs, and Black and Latino communities. Culturally relevant practices. Chapter 7. It talks about ethical issues. Using health educators and other health professionals who can relate to the community in a way that makes it relevant to the practices that enable trust within the community being served. Mr. Estrada, who I had the opportunity to work with, pictured here, is someone who can be culturally related to the patients that he serves. Many who work for Project STAR, who are members of the Latino and Black community, with some speaking languages other than English, which helps them to connect with more patients and earns their trust. Start where the people are. In Chapter 3 in Minkler, it was referenced to improving the health through community organization and community building. Project STAR meets the people where they are by providing services on a mobile unit. They provide services such as HIV testing, HIV counseling, HCV, hepatitis C screening, and substance use preventative counseling, and education to community members on community based organizations and healthcare providers that can help them. Preventing HIV is not just medical, it is a community work. If you have made it this far, I want to thank you so much for listening in to my HIV prevention presentation. But before you go, I would love for you to answer one of the four discussion questions about promoting safe practices for HIV prevention. I will read them out to you. Why do you think that stigma around HIV still exists in communities? How do you think that prevention programs can continue to address the stigma effectively? What role can young people and peer educators play in promoting HIV awareness and safe sex practices? What are some challenges correlations might face when trying to work together on HIV prevention outreach, and how can they overcome them? If you were designing an HIV prevention program for your community, what would be your first step? Together, let us end stigma on HIV patients. Thank you for listening.